Pursuant to Chapter 2 of Acts of 2023, this meeting will be conducted via remote means in accordance with applicable law. Additionally, the meeting will be broadcast live in real time via the Duxbury Government Access Channels, which is Verizon 39 or Comcast 9. Viewers can visit www.pac-tv.org/Duxbury for information about Duxbury programming, including streaming on Duxbury YouTube. Okay, our first item tonight is a continued discussion with the Duxbury Safe Water Committee regarding concerns to the town's public water supply and discuss the final national primary drinking water regulation for 6 items or 6 areas of PFAS. Tracy, is this a general discussion?
Sorry. Yes, I think so. Unless Becky wants to talk. I see that she's on here.
Oh, okay.
Becky, do you want to say anything?
I have a few comments. You want to go first, Tracy, or you want me to go?
I would love for you to talk.
Oh, thank you so very much. Now we all know that the regulation is down at 4 parts per trillion. I have emailed the legislators up on Beacon Hill to see if any of the legislation is still viable. We really don't know. I haven't heard back, but we will know something in July. They may be waiting to refile because the legislation may not be applicable any longer. So we'll know more about local legislation. There is federal. I sat on a webinar today that environmental engineers set up and on how to implement compliance strategies. The deadline for the federal government is 2029 to have our distribution system in compliance. That means I believe now we have 10 out of 12 wells that are not in compliance. That was my from the previous testing that I saw. They're going to require quarterly testing. They can average it annually, but if you have anything that is above 4 MCLs, it's going to be a violation. So the quarterly testing is going to cost the town a little over $14,000 a year. And that's going to go on. They have, because each sample is $300 a sample. And there is a protocol that has to be followed to draw those samples. They now are saying there is a supply challenge because all 50 states now are required to test. And so there's going to be some problems. There is some federal funding. It sounds like a lot of money at 20 billion, but I don't think it's going to go far over 50 states. So, we have to wait and see where we're going to fall into that. But we're sort of ahead of the ball with our votes at town meeting, which I'm very pleased passed strongly. And so that, we may be able to move forward. We have some planning and we have some protocols that we hope will set us in good stead. The last piece is that our committee has received from the Mass DEP a $10,000 technical assistance grant. And so we are going to meet in the second Tuesday of May and see how we think that would be best spent. And that's about it, what I have today.
Well, thank you. That's a lot. I just want to go back in terms of compliance. Did you say 2029?
That's the deadline. That's the drop dead deadline. And we better be moving along before that.
Okay.
Do you recall the water plan that was presented this last summer, last year?
Yes. Well, some of it.
Yeah, when you look at that plan, it's no longer valid.
A lot of it has to be tweaked. Absolutely. And environmental engineers has had a contract with the town, and I believe it's expiring, and they're going to be submitting a new proposed contract, which I think is going to be a whole lot of money in order to update that plan. The master plan for water, is that what you're referring to, Bruce?
Yes, where, it looked ahead, it projected ahead a number of years. I think as many as 7 years or 9 years or 14 years. I don't remember. I haven't really.
It's $75 million.
Yeah. And that's really unencumbered by facts.
Well, there are some facts in there that need to be tweaked. I mean, what they knew at the time, that's what they told us. There's now new information.
Yes, right. And so is there, so you're saying that they're going to redo the plan?
I don't think they're going to redo the whole plan, but they're certainly going to update the pieces that need to be updated.
Is
But
there
it's
some
going to
kind,
put us in a position where we're going to have to take steps for the wells and the PFAS first. Some other
Yes.
infrastructure may have to wait.
well, that plan included that,
Yes, some of it did, yes.
yes.
It was in anticipation. We were fairly certain even last year that the EPA was going to tighten up on the maximum contaminant level for PFAS. It just takes the government a really long time to do it.
But it didn't take them so long. They did it,
Well, it was almost a year.
yeah. So anyway, I would guess you're saying that somebody is somewhere in the Duxbury government has asked the consultants to come up with a new plan.
The Duxbury Water and Sewer Advisory Committee is working with the consultants to finish out what their current contract was. I believe it's finished. And I'm assuming they will make a recommendation to the select board where we need to go forward. And they are the kind of point people to take that forward. But the votes at town meeting did give us money to continue with consultant. One was design, conceptual design and prioritization, and the other was the mitigation. And both those articles passed. So, we have, and I might add that PFAS and PFOA have been already designated as hazardous substances. So we have more power to take action faster than we might if it was just a regular chemical substance that did bad things to our body and our health.
Yeah, because 2029 is really not that far away.
You're right.
And you mentioned that when you just started talking about, I mean, when I saw that, I thought, holy smokes, we really got to get moving.
That's the federal deadline.
Yeah.
April of 2029. Right?
Yeah.
So it's April of 2029.
Yeah.
So I will continue with any updates that you wish me to bring to you. My happy news.
And is part of the strategy with the contractors is to figure out how to get the funding, right? To put in for whatever, however that happens. Okay.
Yes. Part of the contract with environmental engineers was to apply for grants and funding. And they, because they work well, the company that gave the webinar today was Apex Companies, and they're nationwide. And I believe they consult with environmental engineers so that they should know all possible avenues that we should be able to address and request funding through grant writing, but it's going to be very competitive.
Right. The sooner we know about that and, apply for the items that we should, it would be great. And then do we have a timeline? So the contractors will put forth a plan or update the plan that we have. Is there a timeline for that to be completed?
Not that I'm aware of. Okay. As I said, I think environmental engineers has to have a new contract to continue to work.
Before we get to that.
Yeah.
Okay.
And then that will be a piece of it because they're the ones that developed the first plan a year ago.
Okay. Any idea what you're going to use your $10,000 grant for? And congratulations.
We're going to have a good conversation in May.
Okay.
We'll let you know.
Any other questions for Becky? Well, thank you very much. Thank you for your work and really appreciate the update. All right, going on to our second item on our agenda, which is COVID, communicable disease, and dashboard. I think, Lauren, that's you.
Hi. I'm just going to share the dashboard quickly that the state has, if I can get this going. Here we go. So again, this is the state's dashboard for respiratory disease indicators. And it's linked on our website. And you can kind of see if you hover over each, it's hard to see with the Zoom stuff in here. Influenza, moderate, and then it sort of just tells you where these numbers came from, how they got there. And the same is true for COVID and COVID hospital admissions, and then ER visits during the last week for acute respiratory disease was at 11.5%. So it's pretty straightforward. It's a pretty neat tool. And like I said, it's linked on our website under the Board of Health.
Is the 11.5% last week for ED department visits for respiratory disease, does blue means good?
Yes, well, yes, minimal. So that's trending
Okay, I got it.
on the low end. And this is for the week, you can see at the top here, between April 7th and April 13th. And they update it the following week. So they'll update it again tomorrow.
Great. And good to see that the COVID-19 hospital admissions are low too. So that's good. That's definitely trending down.
Yeah, I just have a question. Thanks, Lauren. Back. So it's at 21.6% of people are vaccinated, but what do you know what time period that's for? Is that just for 2024 or, you know?
So let's move this over here. It says, well, you can see it. Vaccination levels are determined by dividing the
Since
number.
July. Wow.
Yeah, July 2nd, 2023.
It's kind of low. I guess people have had enough at this point.
And the
At
same
least-
is true.
At least 78.4% of people.
That's probably, I was guessing that that's the first variant vaccine. The second variant came out this February.
Yeah, so I would think that'd be captured too, but I don't know. It just seems like it's slow. But let's see, one dose updated COVID-19.
One dose.
Yeah.
I don't think it's the first vaccine. I think that's probably like more like 70-ish%. I think it's subsequent vaccines, but I don't know which one. Okay. Any other questions for Lauren?
Yeah, well, it's not related to the dashboard. I guess it's just general health question. I did have a question from someone in the public from another committee asking about measles cases in the state, and whether you know if there are any or what if we have any ongoing measles issues. I don't think there are any in Massachusetts, but I wanted to double check.
I don't think so. That question Kathy would know better.
Okay.
She's on vacation, I think, right now. So I can find out, but I don't think so from listening to some of the calls that they talked about. I know that it is around, but not here, I believe, as of yet.
Thank you.
But I can find out and we'll get that information to you.
Thank you.
Yeah. And with that said, I don't have Kathy's numbers because she's away. So I was away last week when she emailed me that she was away this week. So well, I'll ask her for those and send those to you as well.
Thank you. All right, our next item is H5N1, and this is just a general discussion. I don't know, Tracy, if you have any information to share from any of the conference calls that you've attended about that.
Not really. I put it on the agenda just because it had been brought up to discuss that. One of the things I did find out on one of my meetings was that the state has under the avian influenza, and we can put that link up on our site. You can go to that website and you can report any dead poultry, birds, and it asks you specific questions. For poultry, goes through the state, and if it is wildlife, it was through the Division of Marine Fisheries, and it gives you all that information on their link. As of right now, I believe there was only there was a flock in Essex, and maybe one other. I don't think that there's been other cases of that. And correct me if I'm wrong, Melissa, because I know you were kind of following all that.
Yeah, in Barnstable too. That was a
Okay.
little older, but yeah, just 2 backyard
Yeah.
blocks.
Yeah, so there's a phone number if you we'll post the link on our website, but there is a phone number you can call in, or there's a fillable form that you can do too. It's not asking for like sparrows and things like that as of yet. It's just really, I think, focusing on the domestic poultry. But I don't really have any other information. I put it on there just in case people wanted to talk more about that.
Yeah, so I briefly read that it's been found in cow's milk now, and I'm not sure if it's in Massachusetts or whatnot, but I did do some brief reading today about that. But the general feeling is that because milk is pasteurized, that it's not at this point risky to humans.
Yeah, Karen, I read the same thing, and there was some follow-up to say that they couldn't culture any viable virus from the milk, so it's just fragments. So hopefully that will put to rest any concerns, that you could catch this from milk. It doesn't seem like that's a possibility. I mean, I wanted to bring it up just for the reasons Tracy mentioned, or to have some public information for people who do have livestock in town, and to know that it's out there. And if you do have sick birds or livestock, take precautions. Don't handle them, maybe have some gloves or use precautions around sick animals. Don't kiss your livestock. Just and if you do have concerns, either reach out to your veterinarian or report it to the state, as Tracy mentioned.
Yeah, the
yeah.
state link actually has some good information on it. Frequently asked questions. It also talks about like what to look for, for in your livestock that you have. So just kind of general information. And I had asked Kathy Carney if any of her nursing calls had any discussion on it, and she said not really. It's just been the same, just general information. So
yeah, the CDC the CDC website looks like, as far as cattle anyway, the closest states are Ohio and Virginia at this point so far. Be rampant. It's 48 states in birds, poultry particularly. But it does say, as far as they know, there's no danger from eating chicken if it's well cooked.
Okay. Thank you. Any other comments or questions around that? Right. And next we have health agent updates from Tracy.
So just a couple things. Lauren and I went to a food truck inspection day that was in Hanover. And the South Shore Food Truck Association has been organizing over the last few years this food truck inspection day. It's really great. Anybody that's interested in maybe having a food truck in your town, whether it's at like a private party or a town event or something like that, they'll go there and we can inspect all of them at the same time. I think we did 12, maybe 10 to 12. So it's kind of nice. So we have a list of food trucks. So if anybody needs that, because I know like sometimes the library has events and they want, lists of that. So it works out really well with that. We're also doing some trainings. We have a community sanitation, which will do updates on any beach or swimming pool things that would be coming up for the summer. We're starting to get ramping up for that. Pool inspections will be starting for semi-public pools. Camps are starting this year. I think we have a couple new sports camps. So and then beach testing will be starting. So we'll keep doing with that. Perk tests are starting to pick up again. So I don't know if that shows that the market's doing something. But I'm pretty sure the next couple of weeks I have 6 to 8 perk tests. So that's good. So we're keeping busy with that. And I don't know if I'm missing anything, Lauren.
Do we want to update about the epidemiologist
Oh,
the
yeah,
grant
go
group
ahead.
hired?
Yeah, go ahead.
So our Public Health Excellence Grant Committee successfully hired an epidemiologist full-time that all 6 of the towns will be able to utilize. And she's currently onboarding with Plymouth, who's our host community, with a tentative start date of May 1st. And then we interviewed yesterday for a second part-time public health nurse. So we'll hopefully have that position filled, and then we're still advertising for an outreach coordinator part-time. But things are going along pretty well with the group.
Great. And how do we share the epidemiologist time? How is that shared amongst the group?
So I think it's based on need. So we would just coordinate that with our collaborative has a full-time coordinator who sort of facilitates. So we would just reach out to her and say, we'd like her name's Devin. And we can go from there. But I know that both Plymouth and from the beginning, Duxbury, we've mentioned, the PFAS issues. So that'll be something hopefully that she can get to work on for us.
Yeah, if there's any project or ideas of something that you would like them to work on, just let Lauren and I know, because we can bring that up at the meetings as well. This is probably one of the things that we'll utilize more, as well as the outreach worker, if that ever gets hired. The nurses our community doesn't need really right now. So this is kind of our opportunity to take advantage of the people that are being hired, not to, use their abilities to help us. So if there's something specific that you can think of you would like, we can pass that along.
And that goes for all 6 of our towns. Any of the boards or committees have an opportunity to have any of our shared employees work on things, as long as we facilitate that through our coordinator. So see how that goes.
Did you all have anything particular in mind for the epidemiologists, like in terms of PFAS, or anything else that came up or that you were thinking of to start with? Not yet. Okay.
Not yet.
Okay.
Well, thank you for the updates.
Yeah, you're welcome.
So I think that brings us to the conclusion of our meeting. The next Board of Health meeting is scheduled for May 16th. And I guess I make a motion to adjourn.
Second.
All those in favor? All right.
Is there some minutes we're supposed to approve?
Well, we didn't quite get to those yet. We will the
Okay.
next meeting. Okay.
So I'll work
Go
on
over
There's
that
none
one.
attached. I was just gonna just go over that, but since
Yeah,
you
thank
brought it up,
you.
you're gonna be attached.
Thank you.
I'm gonna work on sending those out. I know I saw some of you on last night's training with the open meeting law, conflict of interest, and so they're really pushing us to try to keep our minutes more within 30-day mark. So we will get that caught up. And
We will get there.
yes.
Well, you know what we'll do? So next meeting, we'll devote a chunk of our time to review the
Yeah.
last couple
Okay.
months.
We'll
How's that, Bruce?
try to get them to you
I'll
so
send
you
them out
can look
tomorrow.
at them
So you
and
have
then
my-
say yes or no. You know, you won't have to read them all. How about that?
Okay.
Because that will take a really long time.
That's fair. Bruce, is that okay with you? Don't hear any objections. Okay. We'll go again. I'll make a motion to adjourn.
Second.
Everyone, aye.
Aye.
Great. Thank you. Thank you, everyone, for your
Aye.
time and attention.